So Genevieve and Anton, I think we can start.
Okay, amazing. Good morning, everybody, or good afternoon, depending on where you're joining us from. I'll just share my screen now, and then we can go from there. Anton, I'm going to need you to confirm that this is working. Good?
Yep. Looks good.
Yeah. Okay, amazing. Well, hello, everybody, and thank you so much for joining us. My name's Genevieve, and I'm super thankful to be presenting today alongside Anton. We both work with Dr. Stephanie Glegg on a variety of KM-related projects. As we gather virtually from across Canada, I did want to start today by acknowledging that I'm joining you from the traditional, ancestral, and unceded territories of the Coast Salish peoples, including the Musqueam, Squamish, and Tsleil-Waututh nations here in Vancouver, Columbia. I am a settler on this land, and I'm committed to continuous learning about the peoples who stewarded it long before me. And I invite all of us to take a moment to reflect on the lands that you're joining from today and the Indigenous communities that have stewarded them for generations. So today we're going to be walking through a resource that Stephanie and I developed last summer that summarizes the effectiveness of different strategies to mobilize knowledge for parents, patients, and the public. But before we do that, I do want to wish you all a happy Halloween, and thank you for joining us this morning. I was joking as we were logging on that I am dressed up as a minion today with some of my fellow colleagues and classmates. And so if you do have your costume, feel free to send a note, or I'd be curious to know what everyone's favorite Halloween candy is in the chat. We've been having some hefty debates about this, at least in my circles. So feel free to send it in. I'm definitely a Wonder Bar girl. And it was always my mom's favorite. So I remember trick-or-treating, we'd always have to dump our pillowcases and then give her every single Wonder Bar that we'd gotten. And so I think it made me love it that much more. But as we begin, feel free to populate the chat with your favorite Halloween candy as we get into the intro. So as I mentioned, we're going to be walking through a resource that Stephanie and I developed last summer to just kind of summarize the literature on how we can effectively mobilize knowledge to parents, patients, and the public. So we developed two different versions of the same information. One we organized by KM strategy, and then the other we organized by effectiveness of the KM strategy for specific outcomes. And so you can see this on the screen. You'll see screenshots from the two different versions. On your top left, it's organized by strategy with the intended outcome, traffic light status, and then the state of the evidence. And then the one on the bottom right currently shows a summary of the strategies that were labeled as green lights for a variety of different intended outcomes. And then you can also see the yellow lights there as well. Alice is going to share some links in the chat, either now or throughout the presentation, where you can find both of these versions on the ChildBright KT library. If you're not familiar with this library, it's actually an excellent spot to find all sorts of KM-related resources of all kinds, and that is where these are going to be housed. So today we're going to start with a very high-level overview of how this resource was developed, and then we'll highlight some key considerations for when you use it. We'll make sure to touch on some of the effective strategies that we found during our search, and then we'll take a break for some questions. After that, Anton is going to guide us through a case study on how this resource has actually been applied to a real-life research project and kind of explain how you could do the same. And then we'll make sure to leave some time at the end, both for feedback as well as some additional questions. So with that, we'll jump in, starting with how we actually created this resource. So this resource and kind of the search strategy behind it was developed with the help of Andrea Rice, who is a librarian at the BC Children's Hospital. We developed a search strategy to find mostly systematic reviews, but also other publications that evaluated the effectiveness of a given KM strategy aimed at parents, patients, or the public. We searched those that you can see on screen, so PubMed, CNOW, and the Cochrane Literature databases. And then we used Google Scholar to find any additional publications that we might have missed along the way by reviewing the citations of the articles that had originally met our criteria. We did limit our search to publications since 2013. So once we'd reviewed the shorter list, we then determined the level of evidence, which basically just means the type of study design that was used in the study. So we used the AAC PDM levels of evidence table for this process. And knowing the study design really helps us to determine how much weight we should put on the findings. So for example, as we are all hopefully familiar with, a large randomized control trial would be a much more robust way, and therefore we could be much more confident in the outcomes that happened because of the KM strategy, not other factors, compared to, for example, a self-report survey. So the level of evidence just determines how they actually collected the data. And then we appraised the quality of evidence using both the AmStar checklist for systematic reviews, as well as the AAC-PDM quality appraisal tool for individual papers. Now, assessing the quality simply means we were looking at how well the researchers conducted the study and reported on what they did. So if, for example, if you don't control for external factors, that might have an impact on your outcomes. For example, we can't be confident that the positive result actually is from the KM strategy compared to perhaps some other type of external factor. So if we don't control for those, that can cause some issues. So a quality assessment helps us also decide how much weight we should put on the study findings. So each of these tools involves a questionnaire, and then you fill out the questions, yes or no, basically, and then you take your number of yeses, and that gives you a score out of the certain number. So as you can see on the screen, for AAC-PDM, it's a score out of 7, where a high quality paper scored a 6 or 7 out of 7. And then for AmStar, it's a score out of 11, where high quality papers score between 8 and 11. So at this point, we've done our search, we figured out our level of evidence, or like what kind of study they used, and then we figured out the quality of evidence to help us appraise how much weight we can put on the different studies. So from there, we were able to traffic light the strategy used. So to do so, we followed guidelines that are shown here on the screen. So green light means that the study showed positive outcomes for the KM strategy for the 3 Ps, so parent, patient, and public, or like one of those 3, and that the study had a high level of evidence, meaning it had a strong design, as well as a high quality of evidence. So it was conducted and reported on well. So green typically means go. These are the studies that you should use, or the strategies, that you should use preferentially. Red, however, means stop. So either there was consistent, high quality, high level of evidence that the given strategy was ineffective, or it's shown to cause harm. Now, we did not identify any red light strategies within our search, and so that is just something to note. As well, yellow light is basically for everything else. And so there's 3 main scenarios where this could be the case. The first is insufficient evidence. So if the level of evidence was low, meaning that the study design itself was not terribly robust, for example, like a self-report survey, that means that the results of it were automatically deemed to be a yellow light, because we can't trust necessarily that the study was robust enough that the evidence that they produced is something we want to put a lot of weight on. Also, if the quality of evidence was low, meaning that they didn't report very well or the way that they conducted it wasn't very sufficient, then again, even if the results were significant, it was determined to have a yellow light. The second kind of main reason why it would be determined to be yellow is if there was conflicting evidence. So if the study was of high level and high quality evidence, but there was conflicting evidence, meaning sometimes it showed to have a significant positive effect, other times there wasn't a significant effect, that would be considered conflicting evidence. This also could show up if you have some like high quality studies and some low quality studies, and they show different things. So there were instances where our low quality studies would have said, hey, this maybe should be a red light, but our high quality studies were green, in which case we would usually take the high quality study over the lower quality study to make sure that we assigned an effective traffic light. And then lastly, the last reason it could be yellow is just if there's no evidence. So sometimes there was certain types of strategies that there's really just not a ton of evidence in the literature about. And so that doesn't mean that it's been proven ineffective. It just means we have yet to research it. And so it would also be given a yellow light. So given this background on how the resource was created and the traffic lighting process, I'm going to shift to just sharing some user notes so that you can more effectively use this resource. So kind of repeating the yellow light metrics, a few things I want to highlight is specifically what creates something to be a yellow light. So as you can see at the top left of the flow chart here on the screen, if the quality of evidence is low, that automatically makes the strategy be a yellow light. So even if it was shown to be like effective, but the way it was measured was not robust, we cannot say that there's sufficient evidence that the strategy is effective. So some specific examples include many of the social media studies where the intended outcome was knowledge, health, or social support. Also, studies that evaluated like general written materials to affect change in health outcomes or program change. Additionally, yellow lights also does not mean that it's not effective. So they simply mean the strategy has not yet been shown to be effective with high level and high quality evidence. And so it really requires us to measure the outcomes of the intervention carefully to ensure that the intended outcome is met within our population. So it's also important to note that if a KM strategy is yellow, it doesn't mean that it's not going to work. In the same way, if it's green, that's not like a guarantee that it's also going to work within your context. These ratings are very much done on the effectiveness in the context with which the studies were evaluated or reviewed. And so I just want to highlight that not all strategies were evaluated for all outcomes. And when I say an outcome, I mean things such as like changing knowledge or increasing skills, changing behavior. Those are all outcomes that we might want to measure. And so there's certain times that the strategies might not have been evaluated on did it increase knowledge, but maybe we know that it does result in behavior change. So we are limited to the knowledge of their effectiveness for the outcome for which they were evaluated within these studies. So for example, here, having a website we found was very effective at improving people's knowledge, but it was not proven to be effective for increasing user engagement, behavior change, or changing health outcomes, at least in the studies that we found within our research. So therefore, it's really integral to keep the outcome that you are striving for front of mind when selecting a strategy, and not just blindly select a bunch of kind of like green light strategies without considering your desired outcome. Because in this example, if you really were striving for behavior change, maybe pairing a website with a more effective strategy for behavior change would be much more effective than just blindly seeing, oh, website has a green light, we're good to go. You want to make sure that you're also looking at what the intended outcome was. As we also just saw with social media and written materials, there was again a mix of yellow and green lights depending on the intended outcome. Just really stressing the fact that it's important to make sure that you start with your intended outcome before you pick your associated KM strategy. So there were many examples also where there was conflicting evidence. So some studies might have showed a KM strategy to be effective and others didn't. Now, I don't know about you, but when I hear conflicting evidence, I picture some like dramatic battle in my head of like red light versus green light, and it's like, who's gonna win? And honestly, that was very uncommonly the case. I will say most of the time, it was more that there was some green light and some yellow light, as opposed to like red versus green battling it out. So for example, some might have showed significant improvements and others might have just shown non-significant improvements, even if there was overall improvements. So two examples of this was e-learning for self-efficacy and digital literacy, as well as counseling or coaching specifically for behavior change. So a little bit of insight into like specifically how these kind of panned out. So for e-learning, we had 3 high-level, high-quality studies, 2 of which showed significant positive results when it came to e-learning for improving self-efficacy. Whereas one actually showed a decrease in self-efficacy after e-learning. So therefore, this was determined to have conflicting evidence. Again, doesn't mean it won't ever work for you because there were results that showed it to be significant, but we can't confidently say that there's consistent significant results because we had high quality and high level evidence that showed both. On the contrary, like for counseling and coaching, we had 6 individual studies, 1 systematic review, and 1 umbrella review that all looked at counseling or coaching. 5 of those papers were of low quality of evidence, so they automatically got labeled yellow. It didn't matter if the results were significant or not. And then the umbrella review and 1 of the individual papers was of really high quality evidence. So the individual paper showed significant results of positive behavior change when using coaching or counseling, whereas the umbrella review definitely showed mixed evidence, where depending on the exact situation, sometimes it was really effective and other times it was not. Overall, we therefore determined that there was conflicting evidence as we had high quality and high level papers that showed different results. So just going to summarize quickly kind of important considerations when you think about using this resource. So first of all, please keep in mind how the tool was made and what it was designed for, which is general guidance. So you don't need to do a literature search every single time you're choosing a KM strategy for a given group or outcome because we've already done it for you. Second of all, context is really key. So make sure to go and review the literature for the strategies of interest so you can really learn about what those key active ingredients were that made it effective. Obviously, it's different in every single study. So once you've kind of overarchingly used the tool to be able to identify the strategies of interest, it's at that point that you can then dive into the literature using the ones that we found or even more recent studies to really optimize your chance of having your desired outcome. And then lastly, it's really important that you focus on your desired outcome when choosing your KM strategy. Like I mentioned, not everything was measured for every type of outcome. And so you can't confidently pick a KM strategy unless you know what you actually want the outcome to be. So now we'll kind of switch to go over some key examples of effective or green light strategies that we found within our search. So as I mentioned at the start, we created 2 different organizations or like versions of the same resource. And so it's all the same information. It's just visually organized in 2 different ways. One was organized by strategy, which is the one that actually has all those lights on it. And then this one was really based on the outcome and then the effectiveness. So I'm going to spend some time highlighting just some of the resources or the strategies, that were really proven to be effective for their evaluated context. So first are the integrated or like multi-method approaches. So for example, when there was video and home visit and a pamphlet, or like a video and a handout, those were proven to be quite effective across a range of outcomes, as you can see on the screen there, for supporting health outcomes and supporting decision-making. So this really highlights the importance of not only selecting sort of like the one way that you want to share your findings, but a combination can often be a lot better, as long as you're choosing your KT strategies to target your key barriers and facilitators. Now, another strategy that is evidence-based is decision aids for improving knowledge and also increasing patient and parent participation in decision-making. And then one last one I want to highlight is that in-person education for knowledge, behavior change, and health outcomes was consistently shown to be quite effective. However, that is contrary to e-learning, which I feel like we've so often shifted to these days, as that does remain to have conflicting evidence across outcomes. Okay, so I know that was a lot of words, so I'm going to pause there and just see if anyone has any questions or comments or feedback just before I pass it over to Anton to walk us through the case study. But we will open the floor. Feel free to send them in the chat or raise your hand. And Alex, I'm going to just rely on you to call on people because I can't see them.
So no questions so far.
Okay, I'm glad I was just so clear. No, I'm kidding. All right, well then on that note, we will have another opportunity at the end to ask questions. So I will pass it over to Anton, who is going to walk us through how a specific project has utilized this resource and how you can as well. Oh wait, I see John, you have a question. I can see the chat. Thanks, John. Super valuable. Right now, our plan is it is on the KT library. I don't know if Stephanie or Alex, you want to hop into if there's plans to further share this tool, but I do know its current home is definitely online there, so people can share it from there.
Yeah, I can jump in. Sorry, I'm under the weather today, but it's Stephanie here. So on the KT library, both versions will be shared. There's also one that's targeting healthcare providers, which I developed with a colleague at Sunny Hill Health Center, and their version is for healthcare providers is on the CDR info source, and I'll put a link to that one. And then we adapted it to present it by effectiveness. So we have Genevieve showed 2 different formats, so we've made the other format. So those 2 are available there. We're sharing through this webinar. We don't have other plans to share it at this time, but if you have suggestions, we welcome them.
Okay, cool. If that's everything, then I will pass it over to you, Anton.
All right. Thanks, Jen. I'm Anton, research assistant working with Dr. Stephanie Glegg. I helped finalize this 3P traffic light resource and get it into the ChildBrite KT library. Definitely visit. One of the projects I'm currently working on is Kids Action Coaching, which we'll use for our case study. Let's go over how you can use this resource to develop a knowledge mobilization plan. In this case study, our researcher will use the 3P traffic light to inform their implementation of the Kids Action Coaching approach into a local community center. This community center, represented by the building with an icon of people on top, hosts a weekly sports program for children with neurodevelopmental disabilities. They've noted that some children in the program want more playtime and wish to improve their skills. Unfortunately, they don't have the capacity to host more activities. Thankfully, Kids Action offers personalized child-centered coaching for physical activities at home. They're represented by the silhouette there with the Kids Action logo. The community center has connected with the Kids Action research team to implement home-based activities into their programming. In their initial meeting, they discussed 3 barriers that stand in the way of children doing home-based activities. First, parents might not value home-based activities. Second, children might not be used to doing physical activity at home. And third, families might not stick to the program. With these in mind, they reframed these barriers into outcomes which they wish to achieve in order to realize their goal. First is to increase parents' knowledge. Second is to induce behavior change. And third, to have adherence to instructions. The rationale is they want parents and their children to understand the value of physical activity at home. For families who don't practice physical activity at home, the desired behavior change would be to start doing physical activities. And for those who don't do it often, to start engaging regularly. Lastly, they want to ensure that families adhere to the home-based activities that are targeted toward their child's personalized goals. Next, the researcher and community center team identified potential strategies to achieve those outcomes. They think these 4 strategies are feasible for their context based on the resources available. First, they have instructional videos which demonstrate the activities. They also have online Kids Action coaching modules which demonstrate how to deliver the program as a coach or as a parent. They have their app which allows families to track their home-based practice and access all the activities in one place. And they also have written materials to inform the parents and coaches about the program, its purpose, and effectiveness. So they have plenty of options. Here I've mapped the potential strategies in column 1 and the outcomes in row 1 of this table. I've placed question marks intersecting the intended outcome of each strategy to show that we don't yet know the evidence to support its effectiveness. Instructional videos and the online modules hopefully affect knowledge and behavior change. The app might influence behavior change, and the written materials might affect knowledge and adherence to instructions, but we don't yet know. It's at this point where we'll navigate to the traffic lighting resource, look for these strategies, and then determine the state of the evidence for our desired outcomes. Here we have the 3P traffic light. The headers on the top row are KM strategy, the intended outcome, the traffic light status, and the state of the evidence for each strategy. Navigating to the bottom left, we can see video with visual and/or oral components, which captures the instructional videos. Under outcomes, knowledge and behavior change both have yellow lights for insufficient evidence. At this point, the researcher can rely on 2 resources to determine why there is a yellow light and how the evaluation of the strategy was conducted. First, they can navigate to that tiny URL link at the bottom of the table to see if the evaluation is contextually relevant to their project. If they choose to proceed with this strategy, they should carefully measure its effectiveness to ensure the desired outcome is achieved. Oh, and by the way, the second thing that you could rely on as a resource is you could also go to the reference list at the end of the document. So you could actually do the literature review and see how the studies were actually evaluated, like Jen mentioned earlier. Next, let's evaluate the Kids Action Coaching online modules, which would be considered e-learning, seen in the bottom left corner of that document there. Under intended outcomes, we can see that behavior change is green for go. It's effective, but knowledge is a yellow light for conflicting evidence. Again, it'll be up to the researcher to refer to those 2 resources and see whether or not it's contextually relevant for their project. Moving on, the Kids Action Coaching app would fall under mobile phone apps, there on the bottom left again. Here we can see it's rated green for go, meaning it's effective for behavior change. Lastly, let's check the evidence for using written materials. Both knowledge and adherence to instructions have green lights, meaning they're good to go. At this point, the researcher has a good idea of the evidence available for their desired strategies. Here, I've tabulated the traffic lighting status for each strategy and the relevant outcomes. Videos are yellow light for increasing knowledge and behavior change. E-learning is yellow light for increasing knowledge, but a green light for behavior change. Mobile apps are green for behavior change. A lot of behavior change studied here. And written materials are green for both increasing knowledge and adherence to instructions. After consulting the resource, the researcher shares the evidence with the community center to co-develop the implementation. At this meeting, the community center shares that videos are super effective in their program. Despite the yellow lights for knowledge and behavior change, they both decide to use it. The key here is to use other strategies to supplement or complement this yellow light strategy and to measure its effectiveness. So they're doing two things. First, combining videos with green light strategies. So they're wanting to supplement behavior change by inviting families to use the Kids Action mobile app. For increasing knowledge, they're offering learning via online Kids Action modules. And they're also using written materials like pamphlets and presentation slides to promote adherence and increase knowledge. The second thing they're doing is evaluating these outcomes by employing knowledge checks at the end of videos and using app engagement to track behavior change and adherence. Now, there may be scenarios wherein the strategies outcomes are all green lights, but your partner deems it ineffective or unfeasible in their context, and that's totally fine. At the end of the day, the strategies can be highly context dependent, which is why we advise you to evaluate their effectiveness when implementing them. We hope that you can use the 3P traffic light as a consolidated resource for quickly determining the evidence for different KM strategies aimed at patients, parents, and the public. A link to this will be available and is already available in the chat box below, so you can bookmark it for later use. At this point, I'd like to open the floor again for any questions and feedback. Thank you, everyone.
Perfect. Again, if you have questions, feel free to send them in the chat or be brave, raise your hand, talk in real life. Either one works.
Thank you, Anton and Geneviève. I have a question. Do you plan on redoing the document in the coming years, like redoing the literature review and updating the documents?
That would be a Stephanie
Yeah,
question.
I think I need to answer that. So it's quite a resource heavy task, as you can imagine, that we went through a search of multiple literature databases and then appraised all the studies. We decided to go with systematic reviews wherever possible to accelerate the process. If funding permitting, yes, we would do that. Hopefully we will. But there's also another one in the works that Anton's leading on evidence on KM strategies for policymakers or decision makers. So you can watch for that coming soon. So I think in large part it will depend on funding interest, although crowdsourcing is a nice way to do it. And I don't necessarily mean pooling money together, but if other folks are interested in combining efforts to appraise, that we can certainly upskill folks in doing that, and together we can keep the resources up to date for longer periods of time.
Thank you. And I see a comment from Ibrahim. Thank you, Ibrahim. Ibrahim says, thanks so much for the excellent presentation. I used the COM-B and TDF before to find the relevant IS strategies, but this one makes it so much easier. Thank you, Ibrahim.
I was going to put a comment in the chat, but I think, yeah, together these are the effective ways, because you can use your theory to identify which you're looking at, which barriers you're trying to target and which outcome you're trying to achieve. and mapping those to the mechanisms of action by which the KM strategies are supposed to work. And then the next piece is to go to the literature or this tool to see what the evidence of effectiveness of those strategies are. So even if you've mapped it theoretically, it doesn't necessarily mean that we know that it's going to be effective. So looking at the evidence is a really helpful way to close that loop.
Okay, oh, perfect. Yes, John, so this is in the works. Anton is currently working on this. And so keep an eye out and we'll definitely make sure to share that far and wide once it is complete. But Anton is your guy for that.
The excitement's good to hear.
Yeah, what we're trying to do is partner with the Policy Hub with ChildBright. And again, if there are folks that are interested in learning at this process or contributing to that tool being developed further or more efficiently or quickly, then just reach out to myself or to Anton or to Alex through the KM program, and we can put you to work in a collaborative, supported team effort.
So
Oh, just one more thing. If
ahead.
there are other audience groups, knowledge user groups that you're interested in, so we've targeted healthcare providers, patients, parents, and the public, and to come policymakers. If there are other groups that are a priority for you, let us know that as well so that we can put it on our list for probably for next summer.
Yeah. And just to Ammet's note in the chat too, she said choosing a strategy would depend on resources too, right? Just something to think about when choosing. That is definitely correct. There's some that are definitely more resource intensive than others. And so that kind of brings back to the point that your own particular context is key in this as well.
Yeah, exactly. And not just resources, but, you know, skill, for example. If you see that podcasts are effective for whatever outcome I'm going to launch into that with no experience or back then, it might be challenging and it might not be as effective as if you followed principles. So I think really you look at what's feasible for you, what the evidence shows, what outcome you're trying to achieve, the specific audience you have, all of these factor in, and you tailor your approach based on all those factors. And if you need support with KM planning, we have KM consultants through the Knowledge Mobilization Program at ChildBright that are ready and waiting to support you. So if one's reached out to you already, then just reconnect with them. If you haven't had a connection, then reach out to Alex and we'll put you in touch with someone who can even just walk through the plan that you might have and give feedback around it or help you connect to the evidence for those strategies, or use theory to map them out. Whatever the case may be, we're happy to help.
Totally. Okay, so on that note, thank you guys so much for joining us today. Our emails are in the chat, and then Stephanie and I's is also on the screen. So if you have any like follow-up questions or comments, feel free to direct it to Anton, myself, Stephanie, or Alex. Alex is just going to quickly send an evaluation poll. We really appreciate your anonymous feedback on today's session before you head off to your next thing. So thank you for doing that. And yeah, please don't hesitate to reach out if there's anything else we can support you with further on this resource. Enjoy the rest of your Halloween. Thank you. The evaluation survey is just in the chat there, if you wouldn't mind. Play on your way out. Thank you.